one of my favorite topics in medicine, and that is when dogs do what doctors can't do. Karma here can sometimes practice medicine better than me. And I'm going to give you 3 times that she actually did what I could not do for my patients. We're going to walk and talk here. I'm at the San Francisco General Hospital here, just as a reminder of how even modern medicine can't always do what ancient wisdom can do from dogs. The first patient I had was an elderly gentleman who had unstable angina. Do you guys know what that is, unstable angina? When someone has the close to heart attack type chest pain. This guy had bad chest pain. He was like on the verge of a heart attack almost all the time, but he really did not want to go on cholesterol medications. I don't want to go into the personal reasons why he didn't want to do it, but after a lot of back and forth with his cardiologist with me, he just didn't want to do it. So I said, hey, you know, the American Heart Association actually has a recommendation for dog ownership because it can significantly improve heart health. We'll talk about why in a second. Long story short, 6 months later, this gentleman not only had not had a heart attack, but some of his cholesterol markers were actually improving. And he didn't start any cholesterol medications. I'm not anti-cholesterol medication, anyone. I want to be very clear that these cholesterol medications can be life-saving, just like dogs can be life-saving. But, in some cases, we can't give medications to people, maybe because of side effects, because of personal preferences, for medication interactions. And dogs can absolutely, by activating the hypothalamic pituitary adrenal axis and helping restore its normal function, by increasing heart rate variability, by increasing physical activity, by helping produce oxytocin, these dogs, like Karma, can help prevent heart attacks, especially if someone's already had a heart attack, in ways that medications can't always replicate. That was the first patient. I want to give some shout outs here to Gina. Vern is asking about cats. We're going to talk about cats in a second. Absolutely, cats are going to come up. Actually, let's talk about cats now, because the second patient I had, whose dog, but the cat would do the same, whose dog saved their life, was a woman who had the beginnings of Alzheimer's type dementia. Alzheimer's dementia, needless to say, is a terribly ugly disease where people lose their quality of life. They can't function independently. Dog ownership has been shown to help improve outcomes and help minimize the decline of dementia symptoms. It can't cure dementia. I'm not saying it's reversing dementia, but unlike any other medications that we have without side effects, dog ownership and cat ownership can help slow the progression of dementia. Aren't you the most cute doggy? Isn't this doggy adorable? Isn't Karma something else? Aren't you something else, baby? So dogs can help, but we suspect by helping produce more oxytocin, maybe more serotonin balancing, can help reduce the stress on the brain and the heart, which are both critical to the progression of heart disease and neurodegenerative disease. Now, if that's not cool enough, I have a third patient for you. And this one actually was with Karma specifically here. Karma, yes, you. I had a patient with terrible depression. This is like borderline, and this is horrible, right? Suicidal depression. And Karma originally frightened the patient. They had come into my clinic for ketamine infusion therapy. They were hoping to help overcome their depression, to help reduce their suicidal ideations. Now, this patient was terrified of dogs because they had been bitten by a dog long ago in their home country. They were terrified of dogs. Halfway through their first infusion therapy with me, you wouldn't believe it, they asked for Karma to come in the room. I've always wanted to share this story with folks on here. I've shared it with other patients before. This patient's life transformed, and their suicidal ideations were significantly improved. I'm not saying Karma alone did all this. Of course, the rest of the medications went a long way. Their psychiatrist, their therapist, all of us worked together here, but Karma did what no one else could do. Karma helped rebalance this fear response that this patient had carried for decades and decades. in a way that medications can't pull off, at least not in my experience, in a sustainable way. Because to this day, that patient's not afraid of dogs anymore, does not go into fight, flight, survival mode every time they see a dog. I attribute this to the neuroplasticity of the treatment. I attribute it to dogs being able to rebalance the HPA axis, to help produce that oxytocin. Just by looking at us, they get a boost of oxytocin, and we get a boost of oxytocin. Our parasympathetic activity, that vagus nerve, you've seen me block the stellate ganglion before, but the vagus nerve right next to it gets activated when we're with dogs. That can help our brain and our heart health. And what's the number one cause of death in men and women in this country and across the world? It's heart disease. And these doggies here can do what medications can't always do, and they can do a better job than me. So I hope you all learned something. If you learned something new, hit that like button, of course. Share what you learned with loved ones. I want to give some shout outs here to J-Bo from Louisville. Nancy, good to see you. And Ring O, yeah. So good to see you. I want to answer a couple of your questions so that you can also maybe help someone who needs some companionship in their life, someone who's lonely, maybe someone who's struggling with heart disease or neurodegenerative disease, be able to open up to having a dog or a cat in their life. Folks who have a dog tend to walk anywhere from 20 to 30 minutes more a day, get some more physical activity. A portion of that is moderate intensity activity. I'm halfway to 500,000 subs. Dale, hey, thank you so much. Let's try to get to the full million by the end of this year. I'd appreciate all of your help in subscribing to help me do these videos for you more often. My favorite trick for Karma, my patients love it, because Karma comes to work with us, you know. I'm going to place her treat on her paw. I'm going to say, leave it. Leave it. Now, leave it. And she's starting to drool. I'm feeling kind of bad for her. And these are high value treats. This is some dry liver here for this doggy. I've asked her to leave it. And now we're going to release. It's the marshmallow test for dogs. Okay. Good girl. Good girl. So I hope everyone learned something new. Please hug your loved ones, your pets a little tighter. And remember that dogs can do what doctors can't. If you learned something new, hit that like button, share what you learned with your loved ones. Remember that you have more power over your health than you've probably ever been told. And never underestimate the healing power of nature, especially with our furry companions.